I'm Rachel and this is Emily, and we are nursing students at Winston-Salem State, and today we're here to teach you guys about breast cancer and the evidence-based practices to use when caring for patients with breast cancer.
So first, breast cancer starts when cells in the breast begin to grow out of control. These cells usually form a tumor that can often be seen on an x-ray or felt as a lump. The tumor is malignant, which means cancer, if the cells can grow into, invade surroundings, or spread, metastasize to distant areas of the body. Breast cancer occurs almost entirely in women, but men can get breast cancer too. Some statistics about breast cancer is the most common cancer in women in the United States. Simultaneously, there is growing demand for cancer care. The United States currently has 14.5 million individuals living with cancer diagnosis, and this number is projected to increase to 19 million by 2024. Each year, 1.6 million individuals are diagnosed with cancer, and the annual rate is expected to increase to 2.3 million by 2030. 1 in 8 women will be diagnosed with breast cancer in their lifetime. Some risk factors for breast cancer would be personal or family history of a known cancer gene mutation, personal or family history of early onset breast cancer, younger than the age 50, personal or family history of triple negative, which is estrogen, progesterone, and HER2 negative breast cancer, personal or family history of 2 primary breast cancers in a single individual, 2 or more family members on the same side of the family with the same cancer, personal or family history of ovarian cancer, and personal or family history of male breast cancer. Some symptoms of breast cancer include invasion of lymph node channels causing skin edema, metastases to the lymph nodes, bone, lungs, brain, liver are sites of metastatic disease from breast cancer, ulcerations of overlying skin, skin changes such as swelling, redness, or other visible difference in one or both breasts, changes in the appearance of one or both nipples, nipple discharge other than breast milk, general pain in any part of the breast, or lumps or nodes felt in or on the side of the breast. The diagnosis of breast cancer. Some cancers will be palpable, and some will only show up on a mammogram. The American Cancer Society recommends that all women have a screening mammogram starting at age 40 to identify early stage cancer and provide a baseline for annual evaluation of breast changes that may suggest cancer. Diagnostic mammograms, in contrast, are done when a patient has a palpable lump or mass. The radiologist then evaluates the mammogram based on standard protocol and makes recommendations for the next step. These 2 chromosomes, chromosome 17 and chromosome 13, have BRCA1 and BRCA2, which are chromosomes that correlate to cancer. The staging of cancer is as follows. Stage 1 is size less than 2 centimeters, no node involvement, and no metastasis. Stage 2, size up to 5 centimeters, may have axillary nodes involvement and no metastasis. Stage 3, varied any size, extended to skin or chest wall, nodes involvement, immovable axillary node. And stage 4 is very distant metastasis with ipsilateral subclavicular nodes.
Some treatments for breast cancer would be radiation, chemo, hormone therapy, surgeries, and complementary and or alternative therapies. Some surgeries that would be used with breast cancer is a lumpectomy, where they just remove the lump found in the breast, a partial mastectomy, where they remove 1/4 or more of the breast, a simple or a total mastectomy, where they remove the breast but no lymph nodes, and then a radical mastectomy, where they remove the breast, the pectoralis major and minor, and then the lymph nodes as well. Some complementary and alternative therapies that can be used would be aloe vera to help healing surgical wounds and prevent treating radiation-induced dermatitis. Mistletoe is used in cancer treatment to protect host cells and kill cancer cells. Massage therapy is used by massage therapists to promote relaxation, musculoskeletal complaints, muscle stiffness, and pain. Key points to do in massage therapy is to avoid sites of open wounds, bruises, skin breakdown, blood clots in the veins, any sites near medical devices or sensitive skin. Nursing interventions with breast cancer would be to teach breast self-examination, which, coming down here to this picture, we want to do that every month after menstruation. And the way that is performed is to start from the inner nipple and work your way out using various techniques as seen in the picture. Nursing interventions also would include some side effects of chemo and radiation, supporting the patient during the staging of cancer and the workup, as that can be very traumatic for patients and learning the conditions of their cancer, and supporting patients during and after treatment, as those times can be very emotional and exhausting. Some evidence-based practices for nurses to use with patients dealing with breast cancer would be to cope with anxiety and depression, to improve quality of life by eating well, physical activity, exercise, which will boost your mood and release endorphins. You want to manage fatigue by trying to do shorter versions of exercises that you really enjoy, eating well and drinking plenty of fluid while taking short naps and breaks throughout the day versus one long continuous rest period. To enhance your memory and concentration, you would suggest using daily mental and physical activities such as reading, puzzles, new hobbies, knitting, games like that will keep your mind working. Lymphedema is very common with breast cancer after surgery, and it can be temporary or long-term, but what you want to do in teaching your patients is to avoid lifting objects heavy over your arm, injections in the arm of the side that the breast cancer surgery was performed, using compression sleeves when you're exercising, and to avoid blood pressures being taken in that arm as well. You do want to exercise regularly, just don't overdo it. When returning to work after breast cancer treatments, it is good for the patients to return back to work, but to do it gradually. You see that they are able to resume a normal routine as they were before. They can focus on other challenges in the day rather than their condition of cancer. They get to reconnect with friends and coworkers, just to do it easy and going back in, especially if you have a physical work. You want to limit your caffeine, tobacco, and salt intake, as all of those are harmful in your bone health. You really want to quit smoking tobacco if you do, and limiting your caffeine intake to 4 cups of coffee a day. Some diet and healthy eating that can help in breast cancer is to reduce fats, as that will also help you lose weight, which is obesity is linked to breast cancer, as well as limiting alcohol consumption. But you want to increase your vegetables and fruits and whole grains, as those are healthy foods and can help you maintain a balanced diet. But you need to consider fats such as nuts and seeds and avocados, so you can maintain, again, a balanced diet. Patient teaching and home teaching after patients are done with treatment, and particularly surgery, is to clearly explain all the treatments and procedures that will be performed on the patient. The experience of phantom breast syndrome, which is tingling or pins and needle sensation in the area where the breast was removed. You want to urge your patients to continue self-examination on the opposite breast that wasn't involved, as well as the tissue of the breast that was, as you have an increased risk for developing cancer in the other breast, as well as recurring cancer tissue in the chest wall. You want to explain to the patients that they'll have drains coming out of surgery to remove the tension and promote healing in those areas. And when the patient is to return home, they'll have dressings and drains as well. And you want to teach them that those drains need to be emptied twice a day and to record that amount and to take that with them to their next doctor visits. You want to teach your patients how to identify and report symptoms of infection or excess drainage that they're having. You want to review the pain treatment medications that they'll have, especially post-operatively. They'll have analgesics to encourage coughing and turning, to promote well-being, and to encourage healing, as well as using pillows for splinting and placing them over the incisions, as that can help with comfort, and putting one under the arm of the side of the breast that was removed. You want to have your patients move and get out of bed as soon as possible. You're going to take precautions to prevent lymphedema again after no dissection, just to exercise that hand and arm on the affected side regularly, but to avoid exercises that are straining on the patient, and again, avoid injuries to the arm, IVs going in, injections, blood being drawn, or blood pressures being taken in that arm. Some resources nurses can provide to patients after breast cancer treatment and during is American Cancer Society, American Society for Clinical Oncology, Fertile Hope, National Accreditation Program for Breast Cancer, National Breast and Cervical Cancer Early Detection Program, and National Comprehensive Cancer Network. These are all resources for cancer patients as well, and specifically for breast cancer patients. It's good to have a community of people there to support you and encourage you along your way.